Welcome to the lecture orientation on nursing documentation. I am Vivian Go from Nursing Quality Improvement Unit Nursing Department of King Fahd Hospital of the University. For the next couple of minutes, let me guide to the short and concise journey of understanding the importance of nursing documentation as essential part of clinical communication between nursing staffs. At the end of the lecture, you will be able to formulate a structured and standardized approach to nursing documentation. In addition, appropriate documentation provides an accurate reflection of nursing assessments, changes of clinical state, care provided and persistent information to support multidisciplinary team approach. The two policies KFHU NUR 17-113 Nursing Documentation and ADM Gen 01-062 Patient Medical Records and Documentation Standards will guide and help you understand. You can find it in KFHU intranet. Let's begin with defining some terms that will help you understand fully this policy. Medical records, or in layman's term the patient's chart, is a legal written or electronic documents which provides information about patient's health status that includes all summaries, X-rays, charts and forms in King Fahd Hospital of the University. Nursing documentation is any written and or computerized recording of relevant data made by nurses to document care or to communicate information relevant to care to other healthcare members. Nurses notes a document that reflects the patient care for each 24-hour period. It is a medical note into a medical or health record made by a nurse that can provide an accurate reflection of nursing assessments, changes in patient conditions, care provided and relevant information to support the clinical team to deliver excellent care. Nursing care plans, NCPs, written tools used by nurses to ensure that planned care is carried out after patients' needs have been identified. A nursing care plan contains all of the relevant information about a patient's diagnoses, the goals of treatment, the specific nursing orders, including what observations are needed and what actions must be performed, and a plan for evaluation. Over the course of the patient's stay, the plan is updated with any changes and new information as it presents itself. It is also considered as the heart of nursing practice. To continue, 24-hour review chart check is the review of physician's order entry by the night charge nurse to ensure accuracy and completeness of the record. TORB, telephone order readback, the process of documenting a telephone order received from the physician by the staff nurse that requires readback to the physician for confirmation. VORB, verbal order repeat back, is documenting a verbal order received by the staff nurse from the physician who is physically present but cannot leave the patient as in emergency situation. Example code blue. The staff nurse receiving the order will repeat back to the physician for confirmation. Hospital Information System, HIS, an integrated system to store, manipulate, and retrieve clinical, non-clinical and administrative information in healthcare organization. In the policy of nursing documentation, all nursing staffs are obliged to comply that include confidentiality of patient's information. Moreover, the patient's medical record should remain in any KFHU facilities. That means, it will be kept in the nurse's station until discharged. When transferring patient to another unit or upon discharge, a patient's record checklist, KFHU ADM 01182, should be completely documented. What are the forms inside the patient's chart? The transferring and the receiving staffs will affix their full name, designation, ID number, and sign the form indicating that he or she received the patient's chart with the listed forms. See example. Electronic or manual documentation utilizing the SOAPIR format should be clear, concise, accurate, written legibly with correct grammar. For manual documentation, each entry must include date, time, name with signature of the staff nurse, designation, and ID number. What does the acronym SOAPIR stands for? S. Subjective data, a description of perception of the problem such as chief complaint obtained by interviewing the patient or family and/or other healthcare professionals. It can be the symptoms or covered data, feelings, history, and even progress. A patient reports or direct quote is, "I am in pain." O stands for objective. This is obtained by the healthcare provider, which includes findings during physical assessment, observation and/or diagnostic procedure that can be measured utilizing the 4 steps of assessment such as inspection, palpation, percussion, and auscultation, IPPA. Also known as overt data. A stands for analysis of assessment, the nurse's interpretation of the patient's condition based on the subjective and objective data. In short, it is the nursing diagnosis. While P planning, a strategy for relieving patient's problem, or the objective to solve including short and long-term actions. I, which stands for intervention, an implementation process of carrying out the plan of care. The E in SOAPIR is the evaluation. The patient outcome or response following the intervention. Lastly, R revision, the modification of plan of care for unresolved problems. In short, it is the nursing care plan. Upon admission in emergency department, the staff nurse will document electronically in the hospital information system using triage nursing assessment. For the nurse's progress note, it will be documented separately or can be in the comment section in SOAPIR format, see example. If the patient needs further observation, the ER nurse in the examination area will hand over the patient to the observation nurse, and the latter will continue documenting her nurse's notes electronically or manually during downtime. For ER patient who stayed within the allowable time of less than or equal to 6 hours, with admission entry, see example. The staff nurse will continue his or her documentation in the nurse's progress notes using SOAPI format, and the latter will hand over to the receiving staff or the admitting unit. However, if the patient stayed more than 6 hours for any reason, the ER nurse will initiate admission assessment. Document in the nurse's progress notes, and all identified problems should be completely documented in the paper-based Individualized Integrated Care Plan, KFHUADM 01072. An Unappropriate Nursing Care Plan. An example of a nurse's notes using SOAPI format for both ambulatory and inpatient settings. Refer to the example. The date written as day, month, and year February 20, 2020, the time documented in military time, 0700 hours. S status post-appendectomy with pain score 5/10. Objective data: facial grimace, guarding behavior. Assessment of analysis: acute pain related to status post-appendectomy. Note that the assessment is numbered 1 and 2 as there are 2 problems identified: acute pain and impaired skin integrity. In addition, because there are 2 problems, also 2 plans. P1 carry out appropriate interventions for relief of pain, P2 have a healed wound. Corresponding to the 2 plans are numbered interventions. I1 instructed to do deep breathing to relieve pain, administered paracetamol 1 gram IV PB as ordered. I2 monitored frequency of turning and skin condition to reduce pressure and promote circulation. For the next intervention, observe it was not numbered. Document all interventions done to the patient respectively, whether related or not to the problem identified. All interventions done shall have corresponding time documented, whether manually or electronically. Lastly, you will end your notes with the e-evaluation by stating the outcome of the interventions done to the problems. Latest vital signs stable, pain score 0/10, dressing intact. Note, all 3 problems are evaluated. For the next shift, if there is no new problem identified, begin your notes with a cont or continuation. The interventions done to the patient with the corresponding time, and end with the evaluation. However, if there's new problem identified, the staff nurse will document using SOAP format. See example. Every entry in the progress notes should be completed with the staff nurse full name, signature, designation, and ID number. Only approved abbreviation allowed in the patient's medical record. Note the highlighted abbreviation ROD. This is not approved abbreviation that can be used either electronically or manually. Please refer to the policy and procedure on approved abbreviation KFHU Administrative General 01-046 located in the hospital intranet. TORB documentation. Telephone orders should only be accepted during emergency situations that requires immediate action and the physician is physically unable to be present to write the order in the time frame needed. Telephone orders should be documented in the QuadraMed or written down in the multidisciplinary progress note during system failure. In the event of emergency, override system to be activated. Orders can be entered, at a later more convenient time, within the shift or 24 hours. Refer to Policy and Procedure Administrative General 01-029. Narcotics or high alert medications are prohibited for telephone orders. Correction of documentation. When correcting error entries in the paper-based patient record during downtime, the nurse should consider the following. See example. Draw a single line through the entry, so that it is still readable. Write the word error above the mistaken entry, and then write your initials and employee number next to the word error. Write the correct entry beside the corrected word. Erasures or the use of correction fluid is strictly prohibited. Correction of documentation electronically. When electronically correcting an accepted documentation, depending on the purpose of the correction, the staff nurse shall select either the correct or supplement button. Refer to example. Note, both the original and corrected electronic entry will be recorded in the HIS. If review of the electronic file is needed for investigative purposes, changes made should be viewed through Data Comparer. Strike-through effect, that is error, will be placed on the deleted entry. Countersigning entries. When documentation is done by the nurse under training, that is orientee or nursing interns, it must be countersigned by staff nurse assigned as preceptor. Late entry. Information will be entered in chronological order. If the staff nurse needs to add information at the later date than the shift on which the nurse provide care, he or she shall do the following. Add the entry to the first available line on the nurse's notes. Identify the time the staff nurse has made the late entry. Start the entry with the phrase late entry for, date and time, write the note then sign with the nurse's full name, title, and employee number in this format. Refer to the highlighted statement. Co-signing entries. If the policy requires two nurses' signature, the assigned nurse shall document and sign, then the nurse who witnessed will co-sign. Note, for electronic co-signing of narcotic and high alert medication, the verifying nurse must enter his or her own user ID and password. Do not leave blank spaces between manual entries. Draw a line through unused spaces so that others cannot add information. See example. Each manual entry must be written in blue or black ink. Red ink shall be used for manual documentation of unresolved problems on the NCP and Integrated Care Plan, PULSE on the graphic sheet. Precaution and allergies to make them stand out from other entries and utilize allergy stickers. Documenting allergies. Part of the patient's history taking is identifying allergies and precautions. The nurse shall document in the appropriate forms, see example, after confirmation from the clinical team. For any changes in the manually documented allergies and precautions, an update shall be documented on the date when it was identified. Refer to example, the word updated and the date are written in black or blue ink but the updated, identified allergy is written in red ink after confirmation by the physician. Note: all entries for known allergies and precautions must be confirmed by the physician and shall be documented electronically. For OPD patients, documentation shall be electronically entered in the hospital information system. See example. The OPD nurse shall initiate minimal assessment electronically utilizing the unscheduled clinic assessment and document her nurse's notes using unscheduled nursing progress note in SOAP format. 24-hour review chart check. The night shift charge nurse shall review and check all order entries from the nursing inbox to ensure that there are no overlooked orders written in the last 24 hours. Note: the 24-hour review chart check shall also serve the purpose of clearing the nursing inbox. Patient's Record Checklist, KFHUADM 01182, shall serve as a guide for the night shift charge nurse when performing 24 hours review chart check. The review shall include the following: physician's order entry for accuracy of transcription and to include the date, time, and the physician's signature. All documentation for completeness. The night shift charge nurse will then document electronically in the nurse's progress notes the phrase review chart check done. See example. Discharge notes. Document discharge instructions given to patient that includes patient education, medication, and follow-up instructions manually in the multidisciplinary patient and family education record, KFHUADM 01012, and electronically. See example. The discharge plan entered as discharge patient. Furthermore, the discharge order should have the final evaluation of the patient condition. Condition of patient upon discharge documented as improved. For the clinical team, discharge instruction should be documented using the appropriate form discharge instruction CLI 002. To conclude, let me ask you some questions. What have you learned? How do you feel? Does it impact you the importance of accurate documentation as part of the nursing practice and as patient safety advocate? I would like to enlighten and encourage you of the importance of the compliance to the policy of nursing documentation, whether documenting electronically or manually. In the research study conducted by Sandra Maddock posted in emarkresearch.com on December 2, 2012, if it is not documented, it is not done. It was emphasized the importance of complete and accurate documentation as reference for any investigation or litigation. It is easy to assume that those in research understand that accurate documentation is one key component to a successful trial. This is to protect the patient, the institution, and the healthcare provider. Keeping these points in mind, complete and accurate documentation leads to ease in the validation of data, fulfills obligations to the institution in relation to staff and patient safety, provides a solid ground for research practice. Moreover, an accurate documentation should be factual, simple, or concise. Finally, documentation should never be a battleground for all healthcare providers, no blaming of staffs or department, no finger pointing, and should never be an opinion documentation. After all, every healthcare provider have the same goal, patient safety. To help you understand further, the following references can be utilized. You can locate these in the hospital intranet. As you begin your journey in King Fahd Hospital of the University, let this statement a reminder of the importance of a complete, accurate, factual, legible, concise documentation as part of the nursing practice. If it was not documented, it was not done. Thank you and more power.